Hello, I'm Dr. Heiner. In this video clip, I'll talk a little bit about prostate cancer screening. Prostate cancer is a disease that men get in the prostate gland. The prostate gland is located right here below the base of the bladder. Here's where we store our urine, and the urine flows through this tube out the penis to the outside world through the prostate gland. The prostate gland's purpose is to make semen. That's its physiologic function. But it can cause problems. As we get older, it can make it more difficult for men to empty their bladder, and also some men will develop prostate cancer. In fact, all men, if they live long enough, will develop prostate cancer. Autopsy studies have shown that in men who are 70 years old, at least 70% of them have some prostate cancer somewhere in their prostate. It might not be enough that it would elevate their PSA, which is the prostate blood test, or that we would be able to feel a lump on a rectal exam, but we know it's there in 70% of men. The more you listen and keep your ears open, the more you'll realize that prostate cancer is controversial. There are many who think we shouldn't be screening for it or diagnosing it or treating it because in general it's a very slow growing disease, and most men with prostate cancer will actually die of something else. The prostate cancer usually is a slow-growing cancer that might take 10 or 15 years from the time it starts to where it spreads all over the body and threatens someone's life and causes painful symptoms. It usually spreads to the bones. And if someone has symptoms from prostate cancer, that cancer is generally very advanced and also incurable, although it may be able to be treated and slowed down, and people with advanced prostate cancer spread or metastatic prostate cancer can have improvement in their symptoms with many treatments. Despite the fact that most people will die of something else, a significant number of men will die from prostate cancer. About 28 to 30,000 men a year in the United States will die of prostate cancer, and the trick is to not be one of them. As of now, we don't have a great way to tell which men with early stage prostate cancer will die of something else and which men will die of their prostate cancer. And so it's quite controversial. Another study that's come out recently suggests that of 10 men who are treated for prostate cancer, only one of them would have actually died from it. But once again, we don't know how to distinguish which of the 10 that person is. Another complicating factor is that in general we're living longer and longer. It seems like every couple of years the average lifespan goes up by a year. So now the average lifespan is about 78, and 100 years ago the average lifespan was about 42. So the fact that we're living longer means that more people will be developing prostate cancer. Also, a lot of the studies that show that men with prostate cancer usually die of something else are 10 to 20 years old, and that is a little bit of a different population, a little bit of an older generation, and men who are living nowadays in general are much healthier due to lifestyle choices and exercise, and we're living longer. So we don't really know how the prostate cancer controversy is going to pan out. We do know it's a real disease. Some men will die from it, and it's a big burden on society and on individuals' lives. So that's what I have to say about prostate cancer screening.